Bismillah. This is heart. It has four chambers: right atrium, right ventricle, left atrium, left ventricle. Okay. So we have lung, so from the venous side the blood enters the right atrium, then it goes to the right ventricle, then it goes to the pulmonary artery, they go to the pulmonary artery and they enter the lung and they make them into capillaries. From the lung capillaries it comes out as a pulmonary vein and it goes to the left atrium. Left atrium. Then the blood enters the from left atrium to left ventricle. Then it goes to the aorta. Goes to the aorta. Now for example it is going to the arterioles and the capillaries and it entering the person's leg. Okay, and it giving capillaries, then it forms a vein. It forms the vein and okay. So this is the understanding of circulation. Okay, so the venous blood enters the right atrium. Venous blood enters the right atrium and it goes to the right ventricle by crossing the tricuspid valve, and it goes to the from the right ventricle it enters the pulmonary aorta. So this all has deoxygenated blood. This all has deoxygenated blood. Then it goes to the lungs. It goes to the lungs. and it goes to the lung capillaries. Then they take the oxygen, give the carbon dioxide, and they become oxygenated. Once they become oxygenated, they go to the pulmonary vein and they enter the they enter the left atrium. Once they enter the left atrium, then it goes to the left atrium to the left ventricle. From the left ventricle, it goes to the aorta. It goes to the aorta. It goes to the aorta. Then it is going to the arteries. Okay, then arteries are dividing into the tissues, into medium-sized arteries, small arteries, like that. And they, for example, it is entering the as artery in the leg. When they enter the leg, then the arteries become capillaries, right? Then they form a vein. Okay, they form the vein, and the blood enters the vein. Then it again goes to the inferior vena cava, and blood comes from above superior vena cava. All gets collected. Okay, this is all deoxygenated because in the tissue they give the oxygen and take the carbon dioxide. Understand this? This is the basic circulation. Okay, if the person having some serious disease is taking bed rest, or he is got accident, he is taking bed rest, what will happen? The blood stays more in the leg. The blood stays more in the blood stays more in the leg. This is leg. Okay, otherwise you can call it as a lower extremity. Okay, the blood stays more in the lower extremity if the person is in bed rest. Okay, understand? The bed rest reason may be anything. Okay, but he is in the bed for long period. What happens when the blood stays more? It is called stasis, right? The blood settles and automatically it forms the clot. Okay, and that is abnormal. That is called thrombi. Okay, the thrombi is formed in the deep veins. So it is called deep vein thrombosis. Okay, now the thrombi is getting break. Okay, it is getting break and it is traveling in the direction of the blood. Okay, from the venous side the blood goes to the heart. It is going to the right side of the heart. It enters the right atrium and it enters the right ventricle and it is entering the pulmonary artery. Once it enters the pulmonary artery, the pulmonary capillaries are small in size. It will block the pulmonary capillary. Understand? So now the pulmonary capillary is obstructed by a thrombi which is travelled from the blood. Okay, it's travelled in the blood, which is carried in the blood. So this we call it as emboli. It is pulmonary. It is happening in the lung. It is called pulmonary emboli. Understand? So in the pulmonary emboli, it is up, now they are producing blocking the blood vessel, right? So it should produce ischemia, right? It should produce ischemia. But it's another good thing in the lung is the lung has another blood supply. It is from a bronchial artery. Okay, lung has two blood supply. One is from the pulmonary artery, other one is from the bronchial artery. So the lung will survive. Okay, because it gets another blood supply. Understand? So it is dual blood supply. It is dual blood supply. Dual means two. It is dual blood supply. But if the pulmonary artery itself getting blocked. Okay, if the pulmonary artery itself getting blocked, understand, the main artery is blocked, okay, then it is so severe ischemia, so the lung cannot withstand, okay, the lung will go for injury. So the main artery is blocked, it will produce severe ischemia, that will produce necrosis. What type of necrosis it will be? Except brain, all are coagulative necrosis. So ischemia producing occlusion of blood vessel, producing ischemia, that producing necrosis, that is coagulative necrosis. This whole process is called infarction. This whole process is called infarction. The area which is necrose, that is called infarct. So now this area is dead, right? It is gone for necrosis. So this area is called what? Infarct. So infarct means what? Infarct means occlusion of blood vessel producing ischemia, ischemia producing coagulative necrosis. This whole area is called infarct. Okay, ischemic related coagulative necrosis, ischemic related coagulative necrosis, understand, it is called infarct, right? Okay, see, but the lung, if it is very small vessel is obstructed, the lung will survive because they get blood supply from the another artery called bronchial arteries. Okay, lung gets two blood supply, these are all basic, you should know. It gets two blood supply, one is from the pulmonary, other one is from the bronchial. Okay, let's see what happens if there is something happens um, in the brain. For example, if there is some thrombi in the heart, the thrombi gets break. Okay, the thrombi travels where? It travels in the aorta, right? It travels in the systemic circulation. It travels in the systemic circulation. For example, this blood is going to the brain. This blood is going to the brain. Okay, so this is going to the brain. Okay, and the and it is going to the brain, and the thrombi is also traveling in the brain. When anything carries it in the brain, it is called emboli. It is thrombi, it is called thromboemboli, and the thrombi is entering into the brain and it is going to obstruct the brain capillary. Okay, brain blood vessel. So the brain goes for immediate necrosis. The brain goes for immediate ischemia. The brain goes for immediate necrosis. This is will produce liquefactive necrosis because it is brain. Understand? It will produce liquefactive necrosis. Understand? So this is the area of necrosis created due to what? Due to blockage in the blood vessel. Due to what? Because of the emboli, because of the thrombi formed in the heart. The cardiac mural thrombi is broke and it is traveling in the blood, and as a emboli it is going to the brain and it is blocking the brain blood vessel, and that area is going for ischemia because brain doesn't have two blood supply. Okay, and brain doesn't store anything. Understand? They immediately go for necrosis. This is again ischemia related occlusion related ischemia related necrosis, it is called infarct. It is happening in the brain, it is called cerebral infarct. Cerebral infarct. Okay, I'm giving another example. And if the person gets blood supply to the kidney, right, it gets blood supply to the kidney, so that is the renal artery which supplies the blood to the kidney. So something happens in the renal arteries. Okay, for example, the renal artery enters the kidney and they give branches. Okay, and this branch gets blocked. Okay, and the renal artery don't get blood supply from any other artery. It gets only blood supply from one artery, that is renal artery. If the renal artery enters, they give branches. If one of the branches gets blocked, understand, the necrosis, ischemia will be created. Understand, ischemia will be created, and ischemia will create necrosis. It is not a brain, it will be of coagulative type necrosis, and the necrosis will be like this. Understand? So the necrosis is like a wedge shape. Understand? The necrosis is like a wedge shape. You all understand? It is like a wedge shape. So wedge shape means they will have a base. Okay, this is called base. Understand? So this blocked area, that is called tip, that is called apex. This is called apex. So this all, most of the infarcts are all wedge shaped. Wedge shaped. Okay, and the blocked blood vessel will be at the apex. See, the blocked blood vessel is at the apex. Okay, the blocked blood vessel will be at the apex. Understand? So when you see, when you want to locate the blocked blood vessel, where you will have to see? You have to see at the apex of the infarct. Understand? So all the infarct will be of wedge shape. Okay, so I gave some 3 examples. Okay, so brain goes for immediately ischemia, right? Because they don't store anything. So the vulnerability, that is the ischemia affecting the any organ, it is depend upon the tissue. Understand? It is depend upon the tissue. For example, if the ischemia comes to the muscle, the skeletal muscle, they will not die immediately. They will withstand for 2 to 3 hours because they have glycogen. They can withstand on anaerobic respiration. Like for example, heart will not die immediately. It will take 30 to 40 minutes. Why? Because heart also stores some amount of glycogen. Why the brain is dying immediately? They don't store anything. Understand? They don't store anything. Clear? So then after then what we discussed is, if the organ has two blood supply, if the organ has two blood supply, they can withstand the small blocks because they get blood supply from the another artery. Understand? So likewise, lung has two blood supply. Another organ which has two blood supply is liver. Liver has hepatic artery as well as blood from the portal vein. Okay, portal vein comes from the intestine that carries lot of nutrition. Okay, that carries lot of nutrition. Understand? Another area which has two blood supply is arm, because they have two blood supply of the radial artery and the ulnar artery. Understand? We have two arteries here. Okay, and we have connection between the two arteries. Understand? We have connection between the two arteries. So if one artery gets blocked, from the another artery the blood comes. Understand? So that kind of connection is called anastomosis. That kind of vascular connection is called anastomosis. Okay. So example, liver, lung, and the hand. They all have two blood supply. Okay. So the organ, the main organ which has only single blood supply, that is very very important, right? Because we should not allow that blood vessel to get blocked. Okay, what is that main organ? Heart. Heart contains only one blood supply. Kidney contains only one blood supply. Brain contains only one blood supply. But little bit the brain blood supply is tricky. Okay, Allah has given some another technique there. Inshallah, that we will discuss in the other modules. So brain also contains but one blood supply. Anterior part of the brain contains one blood supply. Posterior part of the brain contains one blood supply. But both the blood supply communicate each other. Understand? So another organ, spleen. Spleen contains only blood supply. We can tell examples, many examples. Why I am putting this is to understand. Understand? Okay. You all understand this diagram? Okay. Okay. So the infarct, now you all understand the infarct, right? Infarct formation is depend upon the nature of the blood supply. First point. It depends upon nature of the blood supply. What I mean by nature of the blood supply? Whether they have single blood supply or two blood supply. Understand? That is nature of the blood supply. Second point. It also depend upon the tissue. If the tissue has some other means of energy, they will survive. For example, skeletal muscle. They have more glycogen. They can survive some period of time. Heart has some glycogen. They will survive some minutes. Brain doesn't have anything. So they die immediately. Understand? Another most important thing is the duration of block formation. Okay, see, this is okay, this is kidney, and kidney receives blood supply from the renal artery, and from the renal artery it goes many branches. Okay, and from that branch some branches come, and if this gets blocked, what happens? This will go for infarction, right? This will go for infarction. Understand? If emboli coming, if it gets blocked, it is very fast, right? It is very fast. Okay, let's go to the heart. Okay, the heart muscle gets blood supply by an artery called coronary artery. By artery called coronary artery, they give blood supply. See, most of the times the heart blood supply by the coronary artery goes different kind of block. Let me explain. This is the coronary vessel. I am drawing in a bigger way. This is lined by endothelial cells, and just behind endothelial cells fat gets accumulated. Fat gets accumulated. Okay, for example, it starts accumulating at the age of 30, at the age of 30 years. Okay, then after that, if you see, after 5 years it may progress to okay, it is blocking, for example, 30%, right? It is blocking 30%. Then after some years it may progress to it may progress to, it is like 70%, right? It is like 70%. This kind of block is progressive, very slow, right? It is taking years. Okay, it is taking years. So when this kind of block is progressing, now the heart gets some time, right? Huge time, right? So they will try to bring some solution. What they do is, we have right and left coronary arteries. Okay, what they do is, if the block, when there is block forming, okay, the heart receives less blood supply, right? The heart receives less blood supply, so heart receives less oxygen. So heart, what they do is, they will tell the other side artery to give some branch. Understand? They'll tell the other side artery to give some branch. So this is a really power the heart has. Understand it? So the duration of the block is very important. If it is very immediate, they will die, there will be infarct. But if they are progressing slowly, they will try to have some other mechanism to withstand the upcoming coming ischemia. You all understand? So when there is a block like this kind of progression, they will try to survive by bringing the another branch. Okay, so the duration block is very important. Duration of block in thromboembolism, it blocks immediately. Okay, in thromboembolism it blocks immediately, or like this. Okay, if the emboli comes, they block immediately and this area will go for infarction. Whereas in case of atherosclerosis, the blocks slowly progress from 10%, 20%, 30%, like that. And when they are slowly progressing, the heart will develop anastomosing channels. They will develop branching blood vessels, so the heart can withstand the upcoming ischemia. Okay, so another property. So first thing we discussed is nature of blood supply. Second thing we discussed is what? So this is discusses vulnerability to the hypoxia. Remember, second thing we discussed, depend upon the brain, skeletal muscle, the vulnerability of the tissue. Okay, depends upon the tissue. Third point is duration of the block. If the block is immediate, they will die immediately. If it is progressive, then they will try to develop some other mechanism to withstand the hypoxia. The fourth is, if the blood vessel is getting blocked here. Okay, for example, it is 20% block. Okay, and the person hemoglobin is 8 grams per deciliter. Okay, normal hemoglobin in female should be minimum 12 grams. Okay, now it is reduced. The oxygen carrying capacity is normal, or it will be reduced? Hemoglobin carries oxygen, right? So if the hemoglobin is reduced, the oxygen carrying capacity will be reduced. Understand? So if a person, so there are two persons. Okay, the person A is having 20% block and hemoglobin is 8 grams per deciliter. So another person is also having the same block but normal hemoglobin, same 20% block. Who will have more effect? First one. Understand? So it depends upon the quality of the blood. Understand? So the infarct development is depend on 4 factors. One is nature of blood supply. Second one is tissue, nature of the tissue. Third one is duration of the block. Fourth one is what? Blood, quality of the blood. Okay, the blood should have good oxygen carrying capacity. If it is reduced, then the effect will be more. So these are the 4 factors involved in the development of the infarct. Okay, if you are not understanding this 4 concept, it is very difficult for you to understand any vascular diseases in any system. Okay, so please, if you go back and see the video, if you have any doubt, then you come and ask me the doubt. Understand? So I'm mixing all the concepts. Okay, what all the concepts we studied: thrombosis, embolism, infarction. Understand? Infarction means ischemia, necrosis, in all organ coagulation, necrosis, but except in brain. In brain, it is liquefactive necrosis. Understand? So, let's go to the next most important concept called shock. Okay. Okay, now you all know about the circulation, right? Okay. So now I'm going to remove all the blocks. Now the circulation is good. Okay. Okay. So once I remove the block, automatically infarction also goes. Right? Right or wrong? Okay. You all understand this? Okay. So now you concentrate here. Concentrate on this area. Okay. See how much the blood comes in the venous side. How much the blood comes in the venous side, that much the blood comes out. Any doubt? Everybody is clear? How much the blood enters in the heart, that much comes out. Okay, clear? Okay. So this is called venous return. Okay, the blood enters the right atrium is called venous return. Understand? So when the blood comes out from the heart, that we call cardiac output. Clear? That we call cardiac output. Clear? So this is called cardiac output. You all understand this? Okay. So cardiac output, I shortly write it as CO. Okay. It is cardiac output. Okay. If the cardiac output is reduced, I will tell the reason. Okay. Afterwards, if cardiac output is reduced, blood going to the kidney, blood going to the brain, any part of the body, it will be normal, or it will be more, or it will be less. Less. You all clear? 100%. Okay. If cardiac output is reduced, blood flow to the brain reduced. Okay, blood flow to the brain is reduced. Any doubt? Blood flow to the kidney reduced. So cerebral blood flow reduced. Renal blood flow reduced. Clear? Okay. So renal blood flow reduced. Cerebral blood flow reduced. Hepatic blood flow reduced. Understand? So you can give examples. The main problem where the cardiac output is reduced. Okay, when the cardiac output is reduced, the blood flow is reduced. So the blood going to the tissues, okay, it is called perfusion. The blood going to the tissues is called perfusion. Understand? Blood going to the tissue is called perfusion. I am asking, if blood flow to the tissue, the blood flow to the organ, for example, blood flow to the kidney is reduced, renal perfusion will be less or more? It will be less. See, perfusion means blood going into the tissues. Understand? So, if renal blood flow is reduced, automatically the perfusion will be reduced. Okay? if renal blood flow is increased, automatically the perfusion will be increased. If cardiac output is reduced, renal blood flow will be reduced, the perfusion will be reduced. Clear? So when the perfusion is reduced, it is called hypoperfusion. Hypoperfusion. So when cardiac output is reduced, the blood flow to the organs are reduced. Clear? If blood flow to the organs are reduced, the blood going into the tissues also reduced. So blood going into the tissues is called perfusion. That is reduced. That is called hypoperfusion. Hypoperfusion. You are clear? See, when cardiac output is reduced, the hypoperfusion is happening all over the body, right? It is happening all over the body because cardiac output is the center, right? If cardiac output is reduced, automatically the blood flow to all the body is reduced. So all the tissues gets less blood. So it is called systemic hypoperfusion. It is called systemic hypoperfusion. Okay, I'm writing like Arabic. Hypoperfusion systemic. Okay. So you understand the concept. It is called hypoperfusion created in the system. Actually, that is the correct way of telling. So Arabic is correct. Okay. So hypoperfusion created in the system. Okay, that is the meaning in Arabic. Okay. So hypoperfusion created in the system. Understand? So why? Because of reduced cardiac output. Understand? So if there is reduced hypoperfusion all over the body, okay, all over the tissues, all over the tissue going for hypoxia, systemic hypoxia, very very dangerous, right? Whole tissue is going for systemic hypoxia. Understand? The whole tissue goes for injury. Understand? So this is called shock. This is called shock. So it can happen when there is reduced cardiac output. Okay, I'm going to give another condition. If here in the circulation, okay, something happened, the blood is leaking. Okay, something happened. For example, a guy got accident. Okay, the blood lost. Okay, what will happen to his blood volume? It will be reduced. Okay, it will be reduced. Any doubt here? If the blood is going out from his body, the blood volume in his body, in his circulation will be reduced. No doubt, right? It will be reduced. So, is circulating blood volume is reduced, right? So, blood volume is reduced. When the blood volume is reduced, the blood flow to the organs will be less or more? Less. When the blood flow to the organ is less, the tissue gets more blood or less blood? So it is hypoperfusion. Understand? So it is going to happen all over the body. It also creates hypoperfusion in the system. Understand? Hypoperfusion in the system. Here, so these two conditions, reduced cardiac output or reduced plasma volume, just so where we are. So cardiac output is reduced, it will lead to systemic hypoperfusion, and blood volume is reduced, it will lead to systemic hypoperfusion. This whole mechanism will completely collapse all the system in the body. That is called shock. Okay, it collapse complete system, complete whole system, all the system in the body will come to standstill. Okay, they don't know what to do. So that is called shock. Understand? So you should know what makes the cardiac output to be reduced. You should know what makes the blood volume to get reduced. Okay, so it is very simple. Anything which affects the heart, If the heart is not functioning, automatically heart cannot pump. If heart cannot pump, cardiac output cannot be normal. Understand? So heart attack, myocardial infarction. When the myocardial infarction comes, some part of the heart is damaged. Okay, so automatically the heart cannot pump. Understand? If heart attack comes, some part of the heart muscles are damaged. So automatically when the heart is pumping, it will not be like a normal person. Understand? So heart cannot contract properly. It will reduce the cardiac output. Okay. So at least you should know one example, that is myocardial infarction or any damaging, anything which damages the heart muscle. For example, inflammation of the heart muscle. It is called myocarditis. Inflammation of the heart muscle. So myocarditis means heart muscle is going for inflammation. They cannot act normally. That will reduce the cardiac output. Understand? So you should know what are the reasons which reduce the cardiac output. That is called cardiogenic shock. That is called cardiogenic shock. Understand? That is called cardiogenic shock. Okay. When the cardiac output is reduced, the blood coming to the blood vessels is less, right? The blood coming to the blood vessel is less or more? It will be less. When the blood is less, automatically the pressure will be less. Okay, the pressure will be less. So there will be hypotension. So when there is hypotension, the blood is coming less, the pressure is less, the flow will be less. Automatically the tissue, we need pressure to enter the tissue. Okay, blood needs some pressure to travel. So if the pressure is less, they cannot enter the tissue. So hypotension, hypoperfusion, they cannot enter the tissue. Hypoperfusion, these two cause hypoxia. Three hypos happens: hypotension, hypoperfusion, hypoxia. It happens everywhere in the body. It happens in the whole circulation. So that is serious issue. Okay. So in shock, in any type of shock, these three things happens. That is hypotension, hypoperfusion, and hypoxia. Okay. These three things happens. Okay. So when anything which makes the cardiac output to come down, that all comes under the cardiogenic shock. Example, myocardial infarction, myocarditis. Understand? So now anything which reduce the plasma volume, anything which reduce the blood volume, that will produce the same thing, right? That will produce hypotension, that will produce hypoperfusion, that will produce hypoxia. So you should know what causes blood volume to reduce. Very simple: trauma, accident, that will make the person to bleed, that will reduce the blood volume. Another example, it happens commonly in the children. Okay, in poor economic countries, severe form of diarrhea. Okay, the fluid goes out. When the fluid goes out, automatically the blood volume goes down. Another reason, which is happens in severe burn injury. If you see the burns patient, immediately they will swell. Why? Because there will be shift of fluid from the blood. For example, this is blood. The shift of fluid from blood to the interstitium. This is the first step happens in the burns. There will be shift of fluid from the blood to the interstitium. Understand? So when there is shift of fluid from the blood to the interstitium, what will happen? The blood volume goes down. These are the three best examples for reduced blood volume. That is called hypovolumic shock. So we discussed two types of shock. What are they? Cardiogenic shock and hypovolumic shock. Okay. So what happens in shock in general? They produce systemic hypoperfusion. They produce systemic hypoperfusion. What happens in the shock in general? They produce systemic systemic hypoperfusion. Okay, so we discussed one reason is reduced cardiac output, another reason is reduced blood volume. This both will cause what? Three hypos. What are they? Hypotension, hypoperfusion, then hypoxia. Understand? Hypoxia. Okay. So these are the three things happens. When the three things happens, they will produce severe collapse of the entire system in the body. Okay. So what are the causes we discussed? Okay, if it is due to reduced cardiac output, it is called cardiogenic shock. It is called cardiogenic shock. And if it is due to reduced blood volume, it is called hypovolumic shock. Okay, so these are the two shocks are very important for your level, and the very important shock is now I am going to discuss. Okay, that is called septic shock. It is very simple, you all know, just I am going to take from you. Okay, very simple, you all know this, just I am going to give you some clue. Okay, so please cooperate with me. Answer. Now I am going to draw a blood vessel going to the kidney. Okay, blood vessel going to the kidney. Okay, so in septic means what? Infection. It's very clear, right? Yeah, class. Okay, we'll continue after 3 o'clock.
I have a couple of questions for you. First of all, it is a yes, right?
Then that will